Let's talk about some other things on the medical side. So these are medical interventions that you need to be aware of that can contribute to vitamin E deficiency. So I mentioned earlier, if you've had your gallbladder removed, so gallbladder removal or a cholecystectomy, if you've had that done, it makes you more susceptible to vitamin E deficiency. If you've had a bowel resection, if you've had part of your bowel removed, okay, and so some people with Crohn's or ulcerative colitis have had bowel resection. Some people who have used aggressively, who have used drugs like Nsaids, I've seen this happen before. Nsaid induced bowel resection. So if you've used Nsaid, and an Nsaid is a non-steroidal anti-inflammatory. Drugs like ibuprofen, these types of medicines damage and can damage your bowel. And I've seen cases where somebody was taking so much of it that they inflamed and damaged their bowel to such a great degree that it was so inflamed that they had to have a part of it removed, 18 inches, in fact. And so a bowel resection, remember, when you pull out sections of your bowel, you reduce your ability to digest and absorb. So bowel resection, we could say this about any vitamin or mineral, but again, we're talking about vitamin E today. And then there's a couple of different classes of medicines. Predominantly, the one that I've seen be used is cholestyramine, which is a cholesterol-lowering agent. So it's kind of the first generation of cholesterol-lowering drugs. Most people today are put on statins, Lipitor, Zocor, that type of thing. These are not what I'm talking about. I'm not talking about those. Cholestyramine is what's known as a bile acid sequestrant, okay? So basically what it does is, as it sequesters bile, by doing that, it inhibits your ability to adequately absorb fat-soluble nutrients. And so bile acid sequestrants like cholestyramine. Now, another reason why I bring this up is because many people with mold toxicity, one of the things that doctors are prescribing more recently to help clear out mold toxins is this drug right here, cholestyramine. And so if you've been diagnosed with a mold toxicity and your doctor wants to put you on cholestyramine to detoxify or help detoxify you from mold, you just need to be aware that medicine, if you take it too long, it's going to hinder your vitamin E absorption, but not just E, it's going to inhibit A, D, and K and omega-3s as well. So just be aware of that if you're taking that cholestyramine or if you've been prescribed that. Now, if you're on it for lowering your cholesterol because you told your doctor you didn't want to be on a statin, you need to know this. Again, it can cause fat malabsorption problems. Other medicines, epilepsy. So if you're on phenobarbital, phenytoin, Dilantin, carbamazepine, or Tegretol as its trade name, these are also known to interfere with vitamin E. So again, if you're an epileptic, you've been on seizure medicine, this is where, and this is not, so epilepsy medicine doesn't just interfere with vitamin E, it also interferes with your B vitamins. And unfortunately, a deficiency in your B vitamins, okay, can increase your risk of seizure. I know it doesn't make sense for a doctor to give you a drug to treat your symptoms and then to induce a different, to induce a nutritional issue that would actually increase your risk of seizure, but that's the nature of the beast. It's what happens. It happens every day. So just be aware of it so that you can have that conversation. But again, epilepsy medications for epilepsy or seizure disorders are notorious for affecting vitamin E. So just be aware of that if you're fitting any of the bills here, if you're fitting any of the diseases on the previous page. Okay, again, those of you who have these issues and you're being medicated on this other side, you just need to be aware that vitamin E needs to be checked. You need to have it checked. And my advice is to have it checked about every 6 months. And so if it comes back low, you can supplement with it. It's a really easy and really inexpensive thing to do, because go back to what I said at the very beginning. What we say the symptoms of vitamin E deficiency are. We said muscle pain, weakness, difficulty walking, nerve damage, and neuropathy is a very, very common situation nowadays. Cerebellar ataxia, visual disturbance, and anemias. None of these things are uncommon. These are all very, very common reasons why people will visit the doctor. And so if you fit the bill of any of those diseases and you have these symptoms in addition to, what a lot of doctors do, unfortunately, is because they specialize, they put on their tunnel vision goggles. I shouldn't say they put on their tunnel vision goggles. I'll just say they're in a state of perpetual tunnel vision, meaning they're only really looking at you from one lens. And that's the lens of what are your existing symptoms and what can we call that? So like, let's say, for example, you're celiac, and part of the problem is that you developed over years with that celiac disease, you developed a vitamin E deficiency. And in that process, you started to develop neuropathy. And the doctor's saying, and again, I'm just giving you a hypothetical situation. The doctor's saying, okay, you have the neuropathy because you have celiac disease, and it's just a normal part for the course because we know gluten can cause neuropathy. Instead of saying, well, you have celiac disease and it's possible for 10, 15 years, you've actually developed this muscle pain not because of a neuropathy from celiac disease per se, but because of the consequences, which vitamin E deficiency could be one of those consequences. But if they're not measuring your nutrition, if they're not measuring your vitamins, your minerals on a regular basis, they'll never know that. And so then they'll just say, oh, you have neuropathy, let's send you to the neurologist. Then the neurologist will say, oh yeah, it's real common for people with celiac disease to have neuropathy. Let's put you on gabapentin or Lyrica, and that's the end of it, right? And so now you're just being put on a chemical to reduce a symptom that if we just knew about your nutrition, you wouldn't have to go on the chemical. So it's important that you understand nutrients, vitamins, and minerals. I harp on this over and over and over again because they're essential, meaning your body can't function normally without them. And if you don't have them measured periodically, you don't even know whether or not the symptoms that you're experiencing are as a result of those nutritional deficiencies. Because I can promise you this, there are very few board-certified experts in clinical nutrition in the world. I'm one of them. There are others, certainly. But the average doctor that graduates from medical school or chiropractic school or osteopathic school or naturopathic school, they don't necessarily, naturopaths more than any of those probably mentioned, they don't necessarily get a super hyper-focused nutritional training in their background. Medical doctors get less than 7 hours of nutritional training. I know I've said that before, but again, if you're new to the show and this is the first time you're hearing that, listen to what I'm saying. Nutrition is the most important thing you can measure, and your doctor doesn't have more than 7 hours of training in it unless they went on to get postgraduate training, and that's very, very rare in today's world. Okay, last thing I want to talk about here with vitamin E are gluten sensitivity and the vitamin E deficiency symptoms overlap. So again, I was talking about this a minute ago. There are some things that we know gluten can cause. Okay, for example, we know that gluten can cause cerebellar ataxia. We know that gluten can cause muscle pain and weakness. We know that it can cause neuropathy. We know that it can cause anemia. Okay, now, so then the question becomes, if gluten can cause all these things, okay, gluten directly. So this is when I say gluten can cause it, here's what I mean. Gluten-induced inflammation to the area. So gluten-induced inflammation to the muscle, to the brain, to the nerves, to the blood cells, okay? That's one way we know gluten can cause it. Now, we also know that gluten can cause inflammation to the GI tract. And as I said earlier, that inflammation to the GI tract can lead to reduction and absorption. I'm going to abbreviate that. Absorption of nutrients, i.e. vitamin E deficiency, other vitamins, other minerals as well. So gluten can induce inflammation directly to the organs, but gluten can also, as it damages the GI tract, can also damage your body's ability to absorb the vitamin E. So the vitamin E deficiency might be as a result of gluten-induced damage to the GI tract. The vitamin E deficiency might also just be poor diet. And you have gluten issue. So you've got gluten-induced inflammation in the GI tract, but you also have low vitamin E in your diet. And so again, vitamin E deficiency chemically can cause all these things. And because it can, And you may, again, like I said earlier, you might have a history of gluten sensitivity or celiac disease. This is why it's so critical, because of this overlap. Okay, you don't want to just have somebody tell you, oh, it's just the celiac disease creating the problem. We'll send you to pain management. Because it happens every day. It happens all the time. People get sent to neurologists or pain management or rehab, and they get drugs or they get rehabilitation or whatever it might be, but those things don't correct this. They don't correct a potential for a deficiency. And so again, that's what you really want to have looked at. You want to have that analysis done so that you know, is this a true vitamin E deficiency? Does it need to be corrected? Do we need supplementation? Do we need a specific amount or quantity of supplementation to overcome that deficiency and the symptoms that it's creating? Otherwise, what ends up happening is you just blame the disease that you have, and then you just add another drug to the mix, and that's not a solid answer. Okay, last point here. I mentioned earlier the best source of vitamin E is a mixed tocopherols, not just alpha tocopherol, but mixed tocopherols with alpha, gamma, delta, and beta versions of tocopherols. So you want them all. You don't want alpha tocopherol. But if we're looking at kind of quantities, most supplemental preparations are anywhere from 200 to 400 IU or units. And so if we're talking about just kind of a day-to-day quantity, if you're supplementing, this is probably sufficient to prevent a massive deficiency. But if we're talking about a massive deficiency already existing, you need 800 plus, just depending on the situation or circumstances. So again, this is probably enough for day-to-day, but this might be an amount that you want to take if you're trying to overcome a really big deficiency. Now, where you have to be careful with vitamin E, there are a couple of other things to consider. Vitamin E can thin your blood. One of the things that it does at higher doses is it can actually interfere with vitamin K's ability to keep your blood clotted. So we know that vitamin E, it's one of those natural ways to thin the blood. And a lot of doctors will give blood thinners, but we're not even realizing that naturally vitamin E can help thin the blood. But vitamin E can thin the blood. So takeaway here is if you're on a blood thinner, something like an Eliquis or a warfarin or Coumadin, you've got to be real careful, because if you get high levels of vitamin E and you don't tell your prescribing doctor that you're on kind of that combination, you could make your blood too thin. All right, so think about it. If you're walking and you're hitting a wall and you're just bruising and your skin's breaking out in pools of bruise, and you're on a lot of vitamin E, that's something to consider. There are other things that can thin your blood too, but it's when you start combining a lot of different things. So this is just kind of a precaution. If you're going to use this amount, know that it can thin your blood, and just be aware of that interaction so that you don't end up over thinning your blood and potentially having another type of problem altogether. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.